third try here to record this and have the audio work correctly. Welcome to Chapter 5, guys. Today we're going to be talking about the integumentary system. So why does this matter? Okay, well, your skin is a large component of your integumentary system, okay? And your skin is the largest organ in your body, and it helps to protect what's inside your body from what's outside of your body. So this is why you should care about it. It's pretty important. And you're going to see a whole bunch of things about the skin and all the functions that it has that maybe you didn't know about before. So here's the main players that we're going to be talking about today: the skin, hair, nails, and the glands, including your sweat glands and your sebaceous oil glands. So the structure of the skin. There are three main components of your skin. You have the epidermis, which is the outermost, the dermis, and then something called the hypodermis, which is like not exactly part of the skin, but like it's associated with the skin. So like really, it's just the epidermis and the dermis, but like we include the hypodermis too. Okay, so the epidermis is a superficial region of your skin. It consists of the epithelial tissue, and it is avascular. So it means it does not have any blood vessels in it. The dermis underlies the epidermis, so it's deep to it, and it's mostly fibrous connective tissue that is vascularized, which means it does contain blood vessels. Underneath that, you have the hypodermis, which is superficial fascia, and it is a subcutaneous layer. It is the deep to the skin, so it is underneath all of that. It is not really part of the skin, but it shares a lot of the functions. It's mostly composed of adipose tissue that absorbs shock and helps to insulate because it's made of lipids. And then it anchors the skin to underlying structures, mostly muscles. So here's the overall structure of your skin. We're going to be looking back at this picture to see all of the main components that we've talked about at the end, but this is like your little precursor, all the different things that we're going to be talking about. So far, we've hit the epidermis, dermis, and the hypodermis. So the epidermis, this is the outermost region of your skin. We have 4 different types of cells here that we're going to be talking about. So cells of the epidermis. Epidermis consists mostly of our keratinized, stratified, squamous epithelium. There are 4 different types of cells that are going to be found within all of our epidermal layers. The keratinocytes are going to be first. They produce fibrous keratin, which is a protein that helps to give skin its protective properties. It's the major cell that's in the epidermis, like most abundant. It's tightly connected by desmosomes, which help to resist like tension. And millions of them slough off every day, about 50,000 like per minute or something. It's a very high number, and that's really gross to think about. Next, we're going to talk about our melanocytes. Melanocytes are our spider-shaped cells located in the deepest epidermis. They produce pigments called melanin, which is packaged into these little melanosomes. And little melanosomes are transferred to our keratinocytes, where they're actually going to be protecting the nucleus from UV damage, which is why you associate skin color with UV and melanin. They all kind of play together there. We'll hit that later. Thirdly, we're going to have our dendritic cells, which are also called Langerhans cells. And these are star-shaped macrophages that patrol deep epidermal tissues here. So macrophages are, of course, part of your immune system. They are key activators of the immune system. They are phagocytic cells that will engulf foreign invaders. Lastly, we have tactile or Merkel cells. I love that word, Merkel cells. They are sensory receptors that sense touch. So in lab the other day, we did a tactile localization experiment on our hands and our arms with markers to see if you could tell where you were being touched, and you saw some areas are more sensitive to that than others. So there's different layers of the epidermis that we're going to be talking about. Of course, the two, but really 3, I guess, layers of skin: the epidermis, the dermis, and then the hypodermis. We're going to be talking about the 5 layers that are present in the dermis itself. So there are 4 to 5 distinct different layers that you can find in the epidermis. Thick skin contains all 5 layers, whereas thin skin only contains 4 of these layers. And these layers are the stratum basale, stratum spinosum, stratum granulosum, stratum lucidum, and stratum corneum. Now, 1 to 5 there you see written on your screen. 1 is the deepest. Basal means bottom, and the corneum is going to be the highest. It's the most outer, most superficial layer. Okay, and of course, your thin skin would be lacking the stratum lucidum. It would have 1, 2, 3, and 5 in the thin skin. Thick skin has all 5. So we're going to start from the bottom and work our way to the top, as goes life, right? So your stratum basale, or the basal layer, this is the deepest of all the epidermal layers. It is the base layer. It is the layer that is firmly attached to the dermis. Makes sense because that's directly below it. It consists of a single row of stem cells that actively divide through mitotic division, which produces 2 different daughter cells that are genetically identical. One daughter cell journeys from the basal layer up to the surface, taking about 25 to 45 days to reach the surface. And then the cell dies as it's moving towards the surface. Like as soon as you're born, you start to die. It's a little bit morbid, but that's true for our cells as well. Okay, the other daughter cell remains in the stratum basale as a stem cell itself. Okay, so just like our other tissues that we talked about, we have our skin growing from the bottom up. So the cells are produced at the bottom and then they're sent upward to the other layers of our epidermis. This is also known as the layer that is responsible for germination. Okay, germination and growth kind of go hand in hand here because this is where active mitosis is occurring. Okay, this layer also has about, it's composed of like 10 to 25% of melanocytes. All right, our second layer. So remember, starting at the bottom, moving our way up. So we're not in the bottom anymore. We're one layer up from that. It is the stratum spinosum, which is also called the prickly layer. This is several cell layers thick. So these cells contain web-like systems of intermediate prekeratin filaments attached to the desmosomes, which remember we talked about previously that allow them to resist tension and pulling. Our keratinocytes in this layer appear spiky under a microscope, so that's why it's called like prickly cells and a prickly layer. Scattered among all of these keratinocytes are abundant melanosomes and dendritic cells. And of course, we talked about this previously today. Stratum granulosum, and we're still moving up. So this is like the middle layer of our thick skin. Okay, this is also called the granular layer. So we have different granules that we're going to have here. So there's 4 to 6 cells thick here, but these cells are pretty flat. So it's a really thin layer. The cells change appearance over time. So like the cells can be flattened because they're pretty like flat out cells as it is. So that's one appearance that they can have. Keratinization is also going to begin here. So the cell starts to accumulate keratohyalin granules that are going to help to form keratin fibers later in our upper layers. So that's another appearance that they can have. Cells also accumulate lamellar granules, which are water-resistant glycolipids that help to slow water loss. So your skin's kind of helping you stay hydrated by reducing water loss. And then the cells above this layer actually die. So they're too far away from the dermal capillaries to survive. Because remember, as we keep going to 4 and 5, we're getting higher and higher away from the dermis. The dermis is what actually contains the blood vessels. So keep that in mind. Here we have layer 4, which is our stratum lucidum. This is the clear layer, and this is only found in thick skin. So if we're talking about thin skin, it does not have this. Okay, so this stratum lucidum, it's called lucidum because translucent, it's clear. It has 2 to 3 rows of clear, flat, dead keratinocytes. Okay, and it lies superficial or on top, above, outside of the stratum granulosum. And our last layer here is our stratum corneum. It is considered the horny layer. Don't be inappropriate. That's just what it's called. We have 20 to 30 rows of flat, anucleated, keratinized, dead cells here. Yes, dead cells here. Okay, it accounts for roughly 75% or 3/4 of your epidermal thickness, which is most of it, right? It's tough, dead, and the cells still function. Right? So how do these cells function? They function to help to protect the deeper cells from the environment because they're dead. So like they're just kind of like this protective layer. They prevent water loss. They protect from abrasion and penetration. They act as a barrier against biological, chemical, and physical assaults, which we will focus on later. The cells can change by going through apoptosis, which is controlled cell death. So dead cells slough off as dandruff or dander, and humans shed about 50,000 cells every minute, which is absolutely disgusting. If you think about it, in your house at any point in time, you pick up something that hasn't been touched in a while and you see that there's like a clear, like a clean ring left on the surface that you picked it up from. The rest of it's like dusty. That dust is a lot of your skin. Your mom says to dust your room. She means clean up those dead cells. That's disgusting. Okay, it's also made of like clothing fibers and other things like that, but like it's made of you. You made that. That's disgusting. Here's a picture to kind of talk about the different layers that we just talked about. Of course, we're still in the epidermal cells and layers of the epidermis here. Okay, so you have like a nice little microscope image and then also like a friendlier little cartoon image with all of our labels. The dermis is going to be the layer that lies underneath the epithelial layers. Okay, this is a strong, flexible, connective tissue layer that exists in your skin. The cells included here are going to be your fibroblasts, your macrophages, and occasionally mast cells and white blood cells. The last 3 there, macrophages, mast cells, white blood cells, are all part of your immune system to help you stay healthy. Okay, fibers in the matrix bond the body together. So this is going to make up the hide that makes leather, right? When you think about like, oh, my leather jacket, like this is what we're talking about. Okay, it contains nerves, blood vessels, and lymphatic vessels. This is different from our epithelial, or I'm sorry, our epidermal tissues, because it's got blood vessels in it, which is new, right? It contains epidermal hair follicles, oil glands, and sweat glands, which we'll talk about later. And we have two layers that we're going to be talking about: the papillary layer and the reticular layer. These are the two components of your dermis. Here's a picture to show you what it all looks like. We talked about the epidermis. It's on the outside. It's most superficial. We talked about those 5 possible layers. Here, we're talking about the dermis. There are 2 possible layers. You have the papillary layer and the reticular layer. So those are the 2 things we will focus on now. So the papillary layer, this is a superficial layer of areolar connective tissue consisting of our loose, interlacing collagen and elastic fibers and blood vessels. These loose fibers allow phagocytes to patrol for microorganisms. Again, this is part of the immune system. You'll see that as like a common theme here. You have dermal papillae, which are a superficial region of the dermis that sends finger-like projections up into the dermis. And these little like finger-like projections contain these little capillary loops, so like little tiny fine blood vessels, free nerve endings, and touch receptors called tactile corpuscles and Meissner corpuscles. In our thick skin, we have dermal papillae that lie on top of the dermal ridges, which give rise to epidermal ridges. Think about it. If you have ridges below, it's going to like extend to the above because they're going to kind of mirror each other. Collectively, these are known as your friction ridges. They enhance your gripability. So think about like your fingertips. Okay, you can grip things with your fingertips. They contribute to your sense of touch, and then sweat pores in the ridge leaves a unique fingerprint pattern. Here's an example of what that looks like. These are your friction ridges making up a fingertip. You can see the fingerprint here, friction ridges, and then as well as all these little tiny sweat glands present. And when you think about like, oh, you're nervous, you're on a first date, you want to know if you're going to hold hands or not, oh my gosh, what's going to happen? This is what's going to be sweating through your fingertips. All right, next you have your reticular layer, which sits underneath that papillary layer that we just talked about in your dermis. It makes up about 80% of the dermal thickness. It consists of coarse, dense, fibrous connective tissue. It has a lot of elastic fibers that provide stretch and recoil properties. We talked about stretch and recoil earlier, how if you're going to do one, you have to do the other. Very important. Collagen fibers provide the strength and resiliency, so it helps to bind water to keep skin hydrated here. You also have the cutaneous plexus, which is a network of blood vessels between the reticular layer and the hypodermis. Remember that the hypodermis is like that like fake third layer of our skin. It's mostly adipose tissue. The extracellular matrix contains pockets of course, adipose cells. You will also see our cleavage lines in reticular layer that are caused by many collagen fibers running parallel to the skin surface. These are invisible externally, so you can't walk up to someone and be like, hey, nice cleavage lines. Don't be inappropriate. That's not what this means. Okay, these are those parallel lines that run parallel to the skin surface. They're really important for surgeons because if they make incisions that are parallel to the cleavage lines, these incisions are going to heal a lot faster. So here's an example of what these lines would look like. Like I said, don't walk up to someone and be like, hey, nice cleavage lines. You can't see those. They are only like visible on the interior. All right, next you're going to have flexure lines. These you can see. These are all the little things that help you move where your joints are. So the flexure lines of reticular layer are dermal folds at or near joints. So the dermis is tightly secured to the deeper structures. The skin's inability to slide easily for joint movement causes these deep creases. So they're visible on your hands, your wrists, your fingers, the soles of your feet, and your toes. Okay, this is where you have joints, and it helps to move because you don't have a lot of sliding motion happening here. That's why you have these little lines called flexure lines. It's how you move at your joints. So that's what you're looking at here. We have other things that can also occur on the skin. So extreme stretching of the skin can cause dermal tears, leaving these little silvery white scars called striae or stretch marks. And then you have acute short-term trauma to the skin that can cause blisters. This is a little fluid-filled pocket that separates the epidermal and dermal tissues. And this is one of my biggest pet peeves. Don't pop your blisters. It's there for protection because you have some sort of trauma. Let it like do its job to cushion the trauma. Here's an example of what stretch marks look like. Next, we're going to talk about skin color. We're talking about skin. Obviously, skin color is going to be an important factor here. Okay, so 3 pigments contribute to skin color. You have melanin, you have keratin, and you have hemoglobin. So melanin is going to be the first one that we talk about. So melanin is the only pigment made in the skin. It's made by melanocytes. We talked about this previously. Melanocytes package melanin into melanosomes, and then they are sent to the keratinocytes to shield the DNA from sunlight, so to protect from UV radiation. And sun exposure stimulates melanin production. There are 2 different forms of melanin. You can have reddish yellow melanin, or you can have brownish black melanin. All humans have the same number of keratinocytes, so the color differences are due to the amount and the form of the melanin, like whether you have the reddish yellow, the blackish brown, and how much of it. Okay, then we also have freckles. Wow, this is difficult for me today. Freckles and pigmented moles that are local accumulations of melanin. So you just have a stronger prominence of melanin in those particular cells making up those structures. Next, you have keratin. If you've heard of like beta carotene, it's orange, so this could help you out here. It's in carrots. So yellow and orange pigment here. It's going to be most obvious in the palms of your hands and the soles of your feet. It accumulates in the stratum corneum and the hypodermis, and it can be converted to vitamin A for vision and epidermal health, which is why people tell you to eat carrots for good eyesight and good just eye health in general. Lastly, we're going to talk about hemoglobin. Okay, hemoglobin is present in your blood. It accounts for like the pinkish hue of fair skin due to the lower levels of melanin. So these people don't have a lot of melanin. This is the skin of Caucasians that's more like transparent, kind of takes on the color of the hemoglobin. It's like showing through your skin. I resemble that remark. So here we're going to talk about the sun and your skin. So excessive sun damage or excessive sun exposure can damage your skin. We all know this. Okay, elastic fibers can clump up, causing skin to become leathery looking, which is like especially true as you get older. Like if you were in the sun a lot as a kid, like your face and parts of your body exposed to the sun start to get like leathery in appearance as you get older. It can depress the immune system and cause alterations in DNA that can lead to skin cancer, such as thymine dimers that exist in DNA. UV light destroys folic acid, which is really important to help you synthesize new DNA. So this is especially dangerous for women who are pregnant because you need a lot of folic acid to develop an embryo. And then photosensitivity is like a side effect of some drugs that you can be on, like antibiotics or things like that, which leads to just the ability to be burned a lot easier in the sun. Your skin can also change color, which can help to indicate if there's something going on in your body. Like cyanosis is when you have blue skin color. This is like low oxygenation of hemoglobin, which is like if your like lips go a little bit blue, that could be a sign here. Erythema, which is redness, which could indicate a fever, hypertension, inflammation, or allergies. Pallor, which is just like pale skin color, could be indicative of like anemia, low blood pressure, fear, or anger. And then, of course, jaundice, which is like a yellow hue to the skin, could represent some sort of liver damage or liver disorder. Lastly, these two here, bronzing could be some sort of signal of inadequate steroid hormones. For example, this is present in Addison's disease. And then bruising, like black and blues, when you get a bruise, this is clotted blood beneath the skin. These are all signs of something else going on that you can see on the skin. So that's your skin. We're going to talk about hair because we're talking about hair, skin, nails, and glands. So hair consists of dead keratinized cells. There's no hair located on the palms of your hands, the soles of your feet, your lips, the nipples themselves, and then some portions of external genitalia. The functions of your hair is to help to ward off insects on the skin. So they're not actually coming into contact with your skin itself. They're coming into contact with your hair. It's kind of like protecting you. The hair on your head guards against physical trauma because that's your brain. It's important. And then protects from heat loss because we get goosebumps, things like that. And then shields your skin from sunlight. The structure of your hair. So hairs, also called pili, are flexible strands of dead keratinized cells. They are produced by hair follicles, which we'll talk about the structure of that in just a second. All hair contains hard keratin, not like soft keratin found in skin. Hard keratin is tougher, more durable, and the cells do not flake off. If that happened otherwise, like as your hair is growing, it would also be like sloughing off at the same time, like it wouldn't really be changing. So you can grow your hair, cut your hair, it grows back, right? The different regions of your hair, you have the shaft and you have the root. So the shaft is the area that extends above the scalp where keratinization is complete. And then the root, of course, is the area within the scalp, so under the skin surface, where keratinization is still ongoing. We actually have 3 different parts of the hair shaft that we'll talk about: the medulla, the cortex, and the cuticle. So the medulla is the core, the central core of large cells and air spaces. The cortex is going to be several layers of flattened cells surrounding the medulla. And then the cuticle will be the outer layer consisting of overlapping layers of single cells. Next, our hair pigments are made by melanocytes and hair follicles. So just like melanocytes help to contribute to our skin color, they also help to contribute to our hair color. There's different combinations of different melanins that can attribute our hair color here. So we have yellow, rust, brown, black, and then like also like red create our hair colors. So red hair color has an additional pheomelanin pigment. And then we have gray and white hair, which results when melanin production actually decreases and air bubbles are actually replacing the melanin in the hair shaft. Here's a picture of what the hair follicle looks like with the hair growing out of the center. So we're going to talk about the structure of that follicle. The follicle extends from the epidermal surface down all the way through to the dermis. The hair bulb is an expanded area at the deep end of the follicle. The hair follicle receptor, or the root hair plexus, is a sensory nerve ending that wraps around the bulb. And hair is considered a sensory touch receptor because, like, think about like if someone like touches the little tiny hairs on your arm, like you can feel that. So they're a touch receptor. The wall of the follicle itself is actually composed of a peripheral connective tissue sheath, a glassy membrane, and then an epithelial root sheath. So the peripheral connective tissue sheath is derived from the dermis. It's also called the fibrous sheath. The glassy membrane is thickened basal lamina. And then, of course, the epithelial root sheath is derived from the epidermis. Next, we're going to talk about the hair matrix, which is the actively dividing area of the bulb that produces the hair cells. As the matrix makes new cells, it pushes the older ones upward. That causes hair growth. You also have a rector pili, which is a small band of smooth muscle attached to the follicle. This is what's responsible for like moving your skin when you have like goosebumps. You also have hair papilla, which is when we have dermal tissue containing a knot of capillaries that supplies the nutrients for growing hair. Here's a picture of what we just talked about there, all the different structures, all the different parts of the follicle and the root, and the hair itself. There's different types of hair and different growth rates of hair. So we have the vellus hair, which is pale, fine body hair on children and often on adult females. And then we also have terminal hair, which is more coarse and long hair. This is found on the scalp and the eyebrows. And then also at puberty, you start to develop this in axillary and pubic regions in both sexes, and also on the face and neck of males. That's like where a beard would come from. Nutrition hormones, of course, are going to affect growth rate of hair. And then the follicles actually cycle between active and regressive phases. So if you ever like go to get laser hair removal, you have to do it for like 2 years. It's not like every day, but it's like, you know, every couple months for 2 years. Because of these cycles, you want to make sure that you get the regressive phases of all of these follicles as well. You get an average of about 2.25 millimeters of growth per week in your hair follicles, and you lose about 90 hairs from your scalp every day. In women, there's these tumors that can form on ovaries and adrenal glands that produce small amounts of androgens, which is actually a male sex hormone. These tumors can be like pretty large and actually secrete a lot of androgens, which can result in like excessive hairiness or like bearded ladies, right? Or other signs of masculinization. And the treatment, of course, is just to remove these tumors. Hair thinning and baldness can actually occur in both men and women. So we have something called alopecia that can be the hair thinning in both sexes after the age of 40. True baldness is actually genetically determined and sex influenced. Male pattern baldness is caused by a follicular response to something called DHT, or dihydrotestosterone, which is a hormone. So hair thinning can be caused by a whole lot of different things. If you have a very high fever, surgery, severe emotional trauma, certain drugs, protein deficient diets, alopecia, and then some of this hair loss is of course reversible, but then others is more permanent, like from burns or radiation. So we talked about hair, skin, and now nails. That's the name of a vitamin. So your nails are weird, right? They're scale-like modifications of the epidermis that contain hard keratin, just like your hair. So they act as a protective cover for distal dorsal surfaces of the fingers and toes. So you have fingernails and you have toenails. The nail itself consists of a free edge, a nail plate, and a root. The nail bed is actually just the epidermis underneath the keratinized cell plate. And the nail matrix is a thickened portion of the bed responsible for nail growth. You also have nail folds. This is when skin folds that overlaps the border of the nail. You have an eponychium, which is the nail fold that projects onto the surface of the nail body, also called the cuticle. And this is what nail salons will cut off with those scary little tiny scissor-like things. And then you have the hyponychium, which is under the free edge of the plate and accumulates dirt. So like you can use like a nail brush to clean your little dirty hyponychium under there. Nails normally appear pink in color because of the underlying capillaries. Capillaries contain blood. Blood is red, and when it's going through, it's kind of like a pinkish color. You have something called lunule. These are thick nail matrix areas that have it's like that crescent moon that's like kind of like white on your nails. It's just because it's thicker. That's why it looks white. Right? And any abnormal color or shape in your nails can be like an indicator that something else is going on, like a disease or some sort of disorder, just like your skin can be indicative of the same things. Here's a picture of your nail and all the different things that we just talked about. Again, it is just a hard keratinized part of your modified epidermal tissue. Next, we're going to talk about glands. We have sweat glands and we have sebaceous glands that we're going to be talking about. Okay, so the first ones are called sweat glands. These are called sudoriferous glands. These are your sweat glands. They produce sweat. They are in all skin surfaces except for the nipples and parts of the external genitalia. There's about 3 million different sweat glands in each person, and if lined up end to end, they account for about 50 inches of glands whose sole purpose is to make you sweat. There are two main types, the Eccrine or Merocrine sweat glands, and then the Apocrine sweat glands. So these contain myoepithelial cells, which contract upon nervous system stimulation to force sweat into the ducts. So first we're going to talk about the Eccrine or Merocrine sweat glands. So these are the most numerous type of sweat glands. They are very abundant on the palms of your hands, the soles of your feet, and your forehead. The ducts actually connect to pores, which lead to the surface of your skin. They function in thermoregulation, so to help keep your body temperature constant, and they are regulated by the sympathetic nervous system. The secretion here is called sweat, obviously, and it's like 99% water, but then we also have things like salts, vitamins, and then other substances that may be secreted as well. Here's an example of what this would look like. So we have the sweat pore on the surface there, and you have the little coiling of the Eccrine gland. You see that it kind of goes up to the epidermal surface there where you have the sweat pore. And then of course you can see the duct and all of that in the actual microscope picture. Next, we're going to talk about the apocrine sweat glands. So these are confined to the axillary and anogenital areas. So these secrete a viscous, milky, or yellowish sweat that contains fatty substances and proteins. So it's very different in composition than our Eccrine sweat glands secretions. So bacteria break down this type of sweat and it leads to a body odor. So this is very different. Like I said, it has a lot of fat and protein that these bacteria will break down, and then it causes body odor. So these are larger than the Eccrine sweat glands, with ducts emptying into the hair follicles, and they begin to function around puberty, and they're thought to be like a residual sexual scent gland. Like nowadays we cover that up with perfumes and deodorants and things of that sort. But it's probably some sort of vestigial structure that we have. We also have modified apocrine glands called ceruminous glands. These are like the lining of your external ear canal, and they secrete your little nasty earwax or cerumen. So you can actually have both or either or, like a wet, like liquidy earwax, or more of like a solid, sticky earwax. And that's supposedly determined by your genetics, which is kind of cool. And then you also have mammary glands that are going to secrete milk. Next, we're going to talk about sebaceous oil glands. So these are widely distributed except for the thick skin of your palms and the soles of your feet. Most develop from hair follicles and secrete into the follicle because then the oil travels up the hair shaft to reach the surface of your skin. They're relatively inactive in your childhood, like until you reach puberty. And then at puberty, it's stimulated by hormones and especially androgens to secrete sebum, which is a secretion here. It is an oily holocrine secretion. It has sometimes bactericidal properties, which means that it can kill bacteria or like prevent them from growing on your skin. And then it can also soften your hair and skin. So some people follow beauty regimens where they don't wash their hair or their skin, like their face, very often in order to soften their hair and skin. Here's some of the same pictures that we've been looking at, but just like now that you know a little bit more about the sebaceous glands, the eccrine glands, you can kind of point these out in our little skin cross section here. Because we're going to talk a little bit about acne, because we're talking about oil and skin. So whiteheads are blocked sebaceous glands. So they're just like blocked by some sort of like infection. Typically that's called acne. If secretions oxidize, they become blackheads. So like the whitehead actually oxidizes to become a blackhead. Acne is usually an infectious inflammation of the sebaceous glands. And this results in a pimple or a pustule. Overactive sebaceous glands in infants can lead to seborrhea or cradle cap, which I'll show you in the next thing, which is kind of like this pink raised lesion that turns like yellow brown and then like flakes off. There's a picture of cradle cap, which is this overactive oil glands. Okay, so next we're going to talk about the functions of the skin. And there's a whole lot of different functions of the skin. Our skin is our largest organ, and it's doing all these things for us that we don't give it enough appreciation for, right? So skin is first and foremost a barrier. It is a barrier between what is inside of our bodies and what is outside of our bodies. So between you and the environment. It functions in protection, body temperature regulation, cutaneous sensations, metabolic functions as a blood reservoir, and excretion of wastes. So for protection, our skin is a chemical barrier, a physical barrier, and a biological barrier. It helps to keep out microorganisms, protect us against abrasions, temperature extremes, and harmful chemicals. So as a chemical barrier, skin secretes many chemicals like sweat, sebum, and other antimicrobial things like defensins to help us, have like a lower risk of contracting some sort of infection because it can actually kill bacteria and things like that. It's also got an acid mantle, which is a low pH of the skin that actually stops or slows down bacterial growth. And then melanin, of course, provides a chemical barrier against UV radiation damage. Next, it can also act as a physical barrier. So these flat, dead keratinized cells of our stratum corneum on the outermost surface of our our epidermis is surrounded by glycolipids, and it blocks most water and water-soluble substances. So some chemicals have very limited penetration to the skin. So things like lipid-soluble substances, poison ivy, organic solvents, salts, heavy metals, drugs, some drug agents, they can either be like allowed through the skin or not, just depending on their composition, because our skin is this, limited penetrable membrane on the outside of our bodies. Next, it can function as a biological barrier. So the epidermis contains phagocytic cells, which of course we talked about as acting in your immune system. Dendritic cells of the epidermis engulf foreign antigens or invaders and present them to the white blood cells, activating the immune response. The dermis also contains macrophages. Macrophages also activate the immune system by presenting foreign antigens to the white blood cells. And then, of course, DNA can absorb harmful UV radiation, converting it to harmless heat. Body temperature regulation. We all know this. You sweat. So under normal resting body temperature, sweat glands produce about 500 milliliters of sweat per day of unnoticeable sweat. This is called insensible perspiration. So like no matter what, this is how much you're going to sweat. If the body temperature rises above, what it should be, 98.6 degrees Celsius or roughly Fahrenheit or 37 degrees Celsius, dilation of the dermal vessels can increase sweat gland activity to produce roughly 12 liters or 3 gallons of noticeable sweat. This is called sensible perspiration, and it's designed to cool off the body. And then, of course, in cold or extreme cold external environments, we have goosebumps, and then also the dermal blood vessels are going to constrict, and the skin temperature drops to slow passive heat loss. Our cutaneous sensations. So cutaneous sensory receptors are part of the nervous system. We have exteroreceptors respond to the stimuli outside of the body, such as temperature and touch, and a free nerve ending sense painful stimuli. So again, here's that same cross section. We have talked about all of the different elements that are present in this picture now. There's a lot going on in your skin. It's more than just like a simple, empty layer or dead layer that's covering your skin. There's a lot of different players, and they all have different functions. Your skin can also function in metabolism. So skin can synthesize vitamin D that's needed for calcium absorption within the intestines. Chemicals from keratinocytes can disarm some carcinogens, and carcinogens are known cancer-causing agents. Keratinocytes can activate some of your hormones. For example, they can convert cortisone to hydrocortisone. And skin can actually make collagenases, which is an enzyme that breaks down collagen, which aids in the natural turnover of collagen that helps to prevent wrinkles, which we're all going to want someday. Your skin can also act as a blood reservoir. So skin can hold up to 5% of the body's total blood volume. And remember that the epidermis is actually avascular, so not there, but in like the dermis. Skin vessels can be constricted to shunt blood to other organs, such as the exercising muscle. Your skin also functions in secretion. So skin can secrete limited amounts of nitrogenous waste, like proteinaceous waste such as ammonia, urea, and uric acid. And sweating can, of course, release salt and water. The last two things we're going to talk about are cancer and burns. So skin cancer, the skin can develop over 1,000 different conditions and ailments, which is why there's a whole different branch of medicine called dermatology just related to skin. Many internal diseases reveal themselves on the skin surface. So the most common disorders of the skin are going to be like infections. So this is like if you get an infected cut or something of that sort. You're also going to have less common but more dangerous ailments like skin cancer and burns. So those are what we're going to focus on. So skin cancer, most skin tumors or skin cancers are benign. They're not cancerous, and they do not spread or metastasize. We do have the risk factors here of course, overexposure to UV radiation and frequent irritation of the skin. Some skin lotions contain enzymes that can repair damaged DNA, which is really amazing. And there are 3 different types of skin cancers we're going to be focusing on: basal cell carcinoma, squamous cell carcinoma, and melanoma. A basal cell carcinoma is the least malignant and most common type of skin tumor. Stratum basale cells proliferate and slowly invade the dermis and hypodermis, which means it's going to be like a mass that's extending down into the skin, deep into the skin. It's cured by surgical excision about 99% of the time. Here's an example of what a basal cell carcinoma could look like. Next, we have squamous cell carcinomas. This is the second most common type and can metastasize, so it's a little bit more dangerous here. It involves keratinocytes of the stratum spinosum, and usually it's a scaly, reddened papule on the scalp, the ears, the lower lips, hands, places that are like obviously in the sun a lot. And it has a pretty good prognosis overall if treated by radiation therapy or removed surgically. And here's an example of what a squamous cell carcinoma could look like. Lastly, we have a melanoma, which is the most serious. So this is a cancer of the melanocytes. It's the most dangerous type because it is highly metastatic and resistant to chemotherapy. It's treated by a wide surgical excision accompanied by immunotherapy. And then, of course, the key to survival is early detection. So there's something called the ABCD rule, and you know your alphabet, so that's pretty easy. A is for asymmetry. If you have two sides of the pigmented area that do not match, that's a cause for concern. B is for border irregularity. If you have irregular indentions on the surface, then that's a cause for concern. C is for color. It contains several colors like black, brown, tan, sometimes red or blue. If there's more than one color in whatever is happening on your skin, maybe get it checked out. Always better to be safe than sorry. And D stands for diameter. If the diameter is more than 6 millimeters, which is about the size of the pencil on your eraser, then you should probably go get it checked out by a dermatologist. Again, just to be safe. That way you can catch things early so they don't spread. Here's an example of what a melanoma could look like. Lastly, we're going to hit burns. There are 3 different types of burns we're going to be talking about. Burns are when we have tissue that's damaged because of heat, electricity, radiation, or certain chemicals. When we damage skin here, we're talking about the denaturation of the proteins, which actually destroys those cells. It's an immediate threat of dehydration and electrolyte imbalance or loss. It leads to renal shutdown and circulatory shock. And to evaluate burns, we have a rule of 9. So just like the ABCD rule for skin cancer, we're going to talk about the rule of 9s for burns. So the body is broken down into 11 different sections, with each section representing roughly 9% of the body's surface, with the exception of the genitals, which account for about 1%. And then we use the rule of the 9s to help estimate the volume of fluid loss. So these are the different portions, estimating the extent of severity of burns using the rule of 9s. So burns, we have 1st degree, 2nd degree, and 3rd degree. Burns are classified by their severity as 1st, 2nd, or 3rd degree. 1st degree is when we have epidermal damage only. So this is just localized redness, edema, swelling, and pain. So it's not that deep, right? Secondary or 2nd degree burns are when we have epidermal and upper dermal damage. So now it is a deeper burn. There's blisters. That's a telltale sign that it is a 2nd degree burn. And 1st and 2nd degree burns are referred to as partial thickness burns because only the epidermis and some of the dermis are involved. Lastly, we have 3rd degree burns. This is going to be the entire thickness of the skin, so it's referred to as a full thickness burn. The skin color turns a gray, white, cherry red, or black color. No edema or swelling is seen in the area, and it's not painful because the nerve endings are destroyed. They are killed. Skin grafting is typically necessary in these cases. So skin grafting is when they will remove or grow skin and then attach it over the burned area. So here we see an example of 1st, 2nd, and 3rd degree burns. You can obviously tell the progression here. There's quite a difference between all of them. Burns are considered critical if more than 25% of the body is experiencing a 2nd degree burn, if more than 10% of the body has a 3rd degree burn, if the face, hands, or feet bear a 3rd degree burn. And then, of course, the treatment is going to be debridement, which is a removal of the burned skin, which is pretty bad. Antibiotics, of course, to prevent any sort of infections, temporary coverings, and then skin grafts if necessary in the case of like 3rd degree burns. Okay, so we made it through skin. That is chapter 5. That's the integumentary system. Remember, for my kiddos, there's not going to be an exam over this, but there is a large quiz coming up the week before Thanksgiving. Please make sure that you're going back through your notes and working on your tattoo projects to see how tattoos actually affect the different layers of your skin. Thanks for sticking with me. Have a great day.